Okay, let's unpack this. Have you ever considered how the smallest, the most subtle change in an animal can signal a much larger hidden problem?
Hmm.
It's like finding a single loose thread that when you pull it, unravels this whole tapestry of interconnected health issues.
That's a great analogy.
Today, we're taking a deep dive into just such a specific, yet surprisingly complex, equine health condition.
Hmm.
Phimosis in horses. Our mission for this deep dive is, well, to act as your expert guides, sifting through the articles and research you've shared to extract those vital nuggets of knowledge. We want to help you become truly well-informed about the causes, diagnosis, and treatment of this condition. Think of it as a veterinary case study we're going to unravel together.
It's true. And what's truly remarkable about conditions like phimosis is, how they beautifully illustrate the delicate balance within equine health systems. A seemingly simple inability can actually be a sign of anything from, say, a minor hygiene issue to something as serious as a tumor. It really makes astute observation by horse owners absolutely critical.
So to start us on this investigative journey, let's get to the basics. What exactly is equine phimosis?
Okay, so at its core, phimosis is when a horse cannot fully protrude its penis from its prepucial opening, which, many people know as the sheath. It's really important to distinguish this from its counterpart, paraphimosis.
Right, the opposite.
Exactly, where the penis is actually prolapsed, it's stuck out, and cannot be retracted back into the sheath. When phimosis occurs, it immediately complicates crucial bodily functions like, normal urination, proper cleaning, and for stallions, obviously breeding. This can quickly lead to a whole cascade of problems.
So if I'm a horse owner out in the barn, what are those first, maybe subtle clues I might pick up on? That would make me think, something isn't quite right here. What's the immediate red flag?
Well, the most obvious, and often the first sign you'd notice, is the horse simply failing to drop its penis. Whether it's trying to urinate or even just standing relaxed at rest. Beyond that, abnormal urination is a major red flag. You might see urine spraying sort of erratically or even pooling inside the prepucial cavity. And that pooling can lead to inflammation and, unfortunately, a very foul odor. The horse might also show signs of discomfort or pain during urination, what we vets call dysuria, or you might just notice straining.
So not just the inability to drop, but how they actually try to urinate. That's key.
Exactly. And then you might observe swelling or discharge from the sheath itself. This discharge could be purulent, meaning sort of pus-like, and malodorous, especially if an infection is brewing. Physically, you might actually see or feel a thickening of that prepucial opening, or even abrasions on the skin, which we call excoriations, often caused by urine scalding. Yeah, and in cases that have gone on for some time, you'll likely find a significant buildup of smegma, that waxy secretion, which can definitely contribute to a pretty nauseous odor. For stallions specifically, you might see behavioral changes like difficulty attempting to breed or just general pain and reluctance when the sheath area is handled. It all points to discomfort and functional impairment.
Here's where it gets really interesting, the diverse range of things that can actually cause this condition. It's not just one simple explanation, is it?
Absolutely not. It's quite a spectrum, really. We broadly categorize causes into two groups. Congenital, meaning present at birth, and acquired, which develop later on. Congenital phimosis is actually quite rare. It might be an abnormally small prepucial opening or maybe persistent fusion of the internal prepucial folds.
Fusion.
Yeah, and interestingly, these fusions are perfectly normal for foals under about 30 days old. It's only an issue if they persist beyond that. Less commonly, it could even be due to developmental abnormalities or hermaphroditism.
So if congenital is rare, does that mean the vast majority of cases you encounter are acquired?
Precisely. Acquired causes are where we see the bulk of cases. Trauma is a big player. Think anything from breeding injuries to swelling after surgery, lacerations, or any injury to the prepuce that then heals with excessive scar tissue.
Makes sense.
Inflammation and edema are also very significant. We see balanopasitis.
That's a mouthful.
It is. It's the veterinary term for severe inflammation of both the penis and the prepuce. This can be due to bacterial or fungal infections, or even just poor hygiene, where excessive smegma builds up, leading to inflammation and then scarring. Even something as seemingly minor as insect bites or stings can cause acute, severe swelling that leads to temporary phimosis.
Wow, really? Even insect bites?
Yep. And over time, any chronic inflammation or past trauma can result in fibrosis and scarring, making that prepucial opening rigid and inelastic.
So even a simple bite could kick off that whole chain reaction. That's quite a revelation.
It can. Then there's neoplasia. or tumors. The most common tumor of the equine penis and prepuce that can cause a physical obstruction is squamous cell carcinoma, or SCC.
SEC.
And it's important for owners to know that light-colored skin is unfortunately associated with a higher incidence of SCC. Other tumors include sarcoid, which can affect the prepucial skin, melanoma, more common in gray horses, and less often things like papillomas or hemangiomas. But perhaps one of the most surprising and thankfully often simplest to resolve causes is smegma calculi, what we affectionately call beans.
Ah, the beans. I've heard of those. They sound almost harmless.
Yes, but they can be a real problem. These are large, hard stones formed from accumulated smegma within the prepucial folds, especially deep inside, in the urethral fossa. They can physically block the opening. And then there are less common causes like parasitism, specifically habernomyces, certain viral infections like EHV3, or even hematomas or abscesses. So if we step back, what's often surprising about the causes is how many of them, even the complex ones, can trace back to issues like, unresolved inflammation, trauma, or even just accumulated bodily secretions.
Wow, that really is a comprehensive list, connecting everything from minor irritations to serious disease. Given so many potential causes, how do veterinarians pinpoint exactly what's going on? What's the diagnostic deep dive look like for a horse that comes in with these signs?
Right. Well, the diagnostic journey starts with a thorough physical examination, and this almost always requires sedation.
Ah, sedation is key then.
It really is. It relaxes the horse enough for a complete and safe assessment, which is absolutely crucial for this area. We start by gathering information on the clinical signs and history. How long has this been happening? Any past trauma? Has the horse been on any medications? That kind of thing. Then comes the visual inspection and palpation, where we carefully feel the prepucial orifice and the entire sheath for any narrowing, thickening masses or those smegma calculi, those beans.
And I imagine this is where the vet really becomes a detective, feeling around for clues.
Absolutely. One of the most critical diagnostic steps, surprisingly simple yet incredibly effective, is the manual examination. Under sedation, a gloved, well-lubricated hand is inserted carefully into the prepucial cavity to explore the internal folds, the glans penis, and especially that urethral fossa we mentioned. This allows for direct detection of beans, tumors, or adhesions that might be preventing protrusion. It's often the moment where the actual cause is revealed, just by feel.
That's fascinating.
We also use imaging sometimes. Ultrasonography is very useful for assessing thickening of the prepucial wall or identifying deeper masses like tumors, hematomas, or abscesses that you can't feel easily. Endoscopy, specifically urethroscopy or sheath endoscopy, uses a flexible scope to actually visualize internal lesions, strictures, or masses. Gives you a direct look inside.
Like a tiny camera exploring.
Exactly. And finally, for any suspicious lesions, a biopsy or cytology is crucial. This helps us determine the exact nature of the problem, especially for tumors like SCC, sarcoid, or melanoma, or to identify specific inflammatory changes. Virus isolation can also be used if EHV3 is suspected. So, yeah, it's a blend of high-tech and incredibly tactile, hands-on detective work.
It sounds like it. So once the puzzle pieces are put together and a diagnosis is made, what does treatment look like for the horse? What's the path forward?
The critical point here is that treatment depends directly on the underlying cause and, how extensive the problem is. For something as straightforward as smegma calculi, the solution is often simple manual removal, literally just extracting the bean. Pretty satisfying, actually.
I bet.
If it's balanoposthitis, that severe inflammation we talked about, the first step is thorough cleaning of the sheath and penis with maybe a mild antiseptic or just warm water, often followed by topical or systemic antibiotics or antifungals.
So basically good hygiene but medicated. Keeping it clean is step one.
Exactly. For acute swelling or inflammation, treatment involves things like cold hydrotherapy, massage, exercise to help drainage, sometimes diuretics to reduce fluid buildup, and NSAIDs like phenylbutazone or flunixin meglumine for pain and swelling. We do use caution with corticosteroids if we suspect an infection is present, though. Don't want to suppress the immune system too much.
Right, that makes sense.
For neoplasia or tumors, treatment varies widely depending on the type, location, and size. It can range from local surgical excision, making sure to get wide margins, to cryotherapy, radiation therapy, or even local chemotherapy injected right into the tumor. Hematomas or abscesses typically need drainage and diligent wound care, and viral or parasitic infections receive specific systemic or topical treatments based on what they are.
Okay, so that covers medical management. What about when surgery is needed?
Right. If the issue requires surgical correction, we're looking at procedures broadly under the umbrella of phalloplasty, which is essentially reconstructive surgery of the penis or prepuce. For strictures, like a tightening of the external preputial orifice or the internal ring, surgical enlargement might be performed by resecting a triangular section or by incising the internal preputial fold, a procedure called preputeotomy.
Okay.
And sometimes, if the internal preputial lamina, the inner lining, is thickened or has excessive folds that trap urine or smegma, we might perform reefing.
Reefing. That sounds a bit like sailing terminology. What's that involve?
It does sound like that, but here, it's essentially a type of circumcision of those internal folds. It helps to sort of tighten the preputial opening in a way that prevents urine or smegma from pooling inside.
Ah, I see.
More complex cases might even require extensive preputial reconstruction. It can get quite involved. And then, as a last resort for very extensive tumors or intractable phimosis that just can't be resolved otherwise, a phalectomy, which is penile amputation, might be performed.
Penile amputation.
Yeah, it's a salvage procedure. It involves removing the penis and creating a permanent perineal urethrostomy, which is a new opening near the anus for urination. It's vital to understand that this procedure, while it can save the horse's comfort and life, renders the horse infertile.
That's certainly a drastic measure, but sounds necessary in some extreme cases. And what about general medications alongside these treatments? You mentioned NSAIDs.
Yes, general medications often include NSAIDs for pain and inflammation management, systemic or local antibiotics if infection is present or a risk, and sometimes diuretics for acute edema. But there's a critical caution for male horse owners. Phenothiazine tranquilizers, like acepromazine, should be avoided or used with extreme caution.
Why is that particular caution so important with those tranquilizers? What do they do?
That's a really crucial point, because they can cause penile paralysis or priapism in male horses. The penis relaxes and extends, but then can't retract. While it's often temporary, it can lead to severe swelling, circulatory damage, and sometimes permanent damage if not quickly resolved. It could potentially make the phimosis even worse or lead to its opposite, paraphimosis. So it's a very important drug to be mindful of in stallions and geldings.
Good to know. Very important.
And regardless of the treatment path, post-operative care is crucial. This includes continued medication, strict hygiene protocols, and close monitoring by the owner and vet to ensure proper healing.
So what's the long-term outlook for a horse diagnosed with phimosis? And perhaps even more importantly, what happens if it's not addressed? What are the ripple effects down the line?
Well, the prognosis for equine phimosis is quite variable, and honestly, it hinges entirely on the underlying cause. For easily correctable issues like those smegma calculi, the beans, or mild acute inflammation that responds well to medical management, the prognosis is generally excellent. Quick fix, back to normal.
That's good news.
Yes. For cases requiring surgical correction, maybe due to fibrosis or mild tumors, especially if we achieve clear surgical margins, the prognosis is typically good to fair. These horses often return to normal function, including breeding in many cases. However, for cases due to aggressive or widespread neoplasia, like advanced SEC or those that unfortunately require a phalectomy, the prognosis becomes guarded to poor. While a phalectomy does resolve the immediate problem of phimosis and allows the horse to live comfortably, it has significant implications for breeding, obviously, and can lead to long-term care considerations like potential urine scalding around that new urethral opening. Needs careful management.
Right.
And if phimosis is left untreated, well, the ripple effects can be severe. The pooling of urine within the preputial cavity can lead to extensive chronic inflammation, that balanoposthitis we discussed, and eventually severe irreversible scarring. This scarring can ultimately result in infertility or impotence if it becomes too extensive, significantly impacting the horse's quality of life and utility. It's not something to ignore.
That makes the why bother treating it question very clear. It's not just cosmetics.
Not at all.
So this raises an important question then. What can horse owners do to prevent this? Or at least catch it early before it escalates to those more severe stages? What's the takeaway for prevention?
Early detection is absolutely critical. Any inability to extrude the penis, any abnormal urination patterns, or any swelling or unusual discharge from the sheath should prompt immediate veterinary attention. Don't wait and see.
Get the vet involved early.
Exactly. Prompt and accurate diagnosis, followed by the appropriate treatment, significantly improves the chances of a positive outcome. And here's the ultimate takeaway for prevention, really. Regular sheath cleaning and examination are crucial preventative measures.
Ah, the sheath cleaning debate. But crucial here.
It really is. It's the simplest, most consistent thing an owner can do to catch these issues, like finding beans early or prevent them from accumulating and causing inflammation in the first place. Just being familiar with what's normal for your horse.
So the most mundane, routine, stable chore can literally prevent potentially life-altering issues for a horse. That's a powerful message. And that wraps up another deep dive. Today, we've truly seen how a seemingly specific condition like equine phimosis can have such diverse causes, from something as simple as, accumulated debris to complex tumors. It requires a sophisticated blend of diagnostic and treatment approaches. It profoundly reinforces the value of being proactively well-informed about your animal's health.
Indeed. Understanding conditions like equine phimosis truly underscores the importance of diligent observation, consistent preventative care, and the specialized veterinary knowledge required to maintain animal health and well-being. It's a testament to how every little detail matters.
Now, here's a thought for you, our listeners, to mull over or explore on your own. Consider how this deep dive into a specific equine health condition highlights the incredible range of factors, from basic hygiene to complex genetics to environmental influences that can impact well-being across all living creatures. What does this tell us about the hidden complexities even in seemingly simple biological systems, and how much can be gained from just paying closer attention? Something to think about.